We'll now open up the floor for any questions that you all might have. So just, if you have a question, just raise your hand and pass around the mic. So you can ask questions. Do you have any questions?
Thank you. I have a question right for the whole board, and Mr. Longenecker will start this at the part right now. The question is shadowing and volunteering. It's a great idea for students and prospective students to learn about occupations to go into and view what you're doing before. And I just wanted to know if either your group particularly has volunteering, shadowing opportunities, or if you've heard of, if you look at a lot of admissions applications, that you've seen shadowing and volunteering opportunities. So I'm just kind of curious, are there available from your group, or have you heard
Well, we do shadowing all the time in physical therapy at our office. Again, our practice is called Drevna Physical Therapy. It's a private practice here in Lancaster. And actually for the office, I'm the shadowing coordinator. So if you want to shadow, you would shadow me at our office. Usually we offer our high school and college age students who just want to get a feel of it, 10 hours, if you want 10 hours. Usually break up into 2 5-hour days, so they don't get too bored, because you can't really do anything with the patients, you just kind of stand there and watch. But I think it's a fantastic idea. When I was going to school, or trying to get into physical therapy school right now, they required us to have 200 hours of shadowing. It doesn't happen anymore. That's kind of ridiculous. But, there's a lot of settings in the work of physical therapy. We're an outpatient orthopedic clinic. So outpatient, in case you guys don't know, I didn't know when I was your age either, means that they come into our office, do the PT, and then they go home. As compared to inpatient in the hospital. So the reason we limit it to 10 hours is because we say, all right, come see us for 10 hours, that's enough. Now go see how they do physical therapy in a hospital, and now you go see how they do it in a college setting or any other number of settings. I think it's valuable. I'm sure these guys would agree to at least know what you're getting in. What's the day like in oral physical therapy? Coming out of the day, you'll see us laughing and smiling over those days.
I would just say the same thing. I think it's important if you're thinking about any career, whether it's sports medicine, physical therapy, anything, to get a feel for what you're getting into. I know we have opportunities for volunteers with our group. I've had students come and shadow me in the office and see what I do on a day-to-day basis, seeing patients as an outpatient, and then we can also arrange to have some time in the operating room to see what I do there. I know when I was deciding on going to medical school, that's one of the things I made sure I did was go spend time in the clinic. I ended up with the general surgeon up in Effort, but he got me into the OR with an orthopedic surgeon. I didn't know that's what I was going to do, but I had a feeling. So I get an idea of this. Is this something you want to do? You can pick the brains of what are the hours like? What do we got to deal with on a day-to-day basis? Why do we keep coming to work? Why is this such a great thing? Because it really is anything. I don't know about anybody else, but there's not a better job than I do. So anybody who wants to do something like that, feel free to contact our office or myself, and we'll get you situated.
One of the things I've always told students who have any type of interest in medicine is get experience. Look at it. These gentlemen have already said, spend a day, walk in our shoes for a day. See what it's like. You may spend a few days or weeks and all of a sudden go, nah, not doing that. Or you might say, yeah, this is what I thought it would be, this is what I wanted to be. I've had students shadow me, volunteer with me for a week, a season. I've had students follow me for a couple of years. I've been lucky to have over 24 former students who are now certified athletic trainers. That started with me. Some of my former students are PTs, PAs, MDs. You know, it's, the experience is what it is. You go to college in any of these fields here, and you have experience, you have a leg up on the people who decided just to do it. Because you'll know, as Lyn said, you'll know if you like science. And if you don't like science, this ain't the place for you. Okay? But get experience. All of us up here would welcome shadows, volunteers. All you have to do is step up. For the students here at Township, if you're not sure where to go, come talk to me, and I will get you in contact with Drevna PT or Dr. Horney or Dr. Vollmar or Paul Pettay, whatever you want to do. We'll get you started. But it's very important, and it's the opportunities are out there.
I find there's people who contact us regarding shadowing opportunities, and generally those are handled through the hospital itself. We are not, when I say we, the college itself does not dictate who can go into the hospital setting and that kind of thing. And they have to make sure, for HIPAA reasons and that type of thing, that there's that has been addressed. And some of the opportunities are easier to get into. Some of the, I should say, areas are easier to get into than others. But you can contact the hospital and see. I do know that they don't accept shadowing guests all the time. I think they have certain times when they do that, sometimes in the year. Because to be very frank, there are a fair number of requests for that. I do know that they have a volunteer opportunity as well for some students. You may want to contact Manager General about that to see what insight they can give you. But I know that I believe it's junior and seniors can do a volunteer experience, and that's, I think they offer that in the winter time and also in the summer. So you may want to check with them about that as well.
We, in our office, we offer two types of job shadowing. So one, any high school student, college student can come, just call me up, and we can set up a time they can come in for a day, half a day, whatever, if they're home from school, from college, if they're interested in going into the chiropractic profession. We've had high school kids that have done senior projects that have come in and observed, and they've compared all the different professions, and shadowing is one. And then secondly, if you are in chiropractic school, we also do internships with chiropractors that are in the last trimester of their schooling. And in that case, they come in, so one, they're seeing what's going on clinically, but also two, we'll get into more the business aspect of it. Because in a lot of cases, we have to kind of do everything. So we do all the business stuff, we do oversee all the billing, all the other business side that you don't really get a lot of in school. I think we can all agree that that's one thing that medical school or all the different health services, they really do nothing for you from a business standpoint. So if you are working on your own, it's a really important part of the process. And so we're unique in that we opened up with not knowing anybody in the area and just coming in here. So that's one thing that we really try to help out a lot with and we're still trying to figure stuff out ourselves. So it's not like as if we're experts, but we can at least avoid some mistakes. So those are the two areas that we do, but we're happy to have interns at any time or shadowers or volunteers.
We frequently bring in high school and college and medical students and medical residents, and now a big part of PA students into the office for shadowing or time. I know for the PA students that most of the schools are requiring a minimum of 500 hours of activity in the healthcare field as part of their application process. So some of the schools have even been as rigid as going for 1,000 to 1,500 hours. So if that's something you're interested in, you want to be prepared for that. I think one of the other things is when you walk into one of our offices, you get to see the neat things, the procedures, the activities that we do. But one thing you really have to also get used to is, are you going to be comfortable interacting with a patient? Can you talk to a patient? Can you get a patient's blood pressure without getting nervous about putting the blood pressure cuff on, stuff like that? You need to also realize it's not just a science, it's not just a technique,